going towards the future. I always feel like the future is now. And how you was talking about, with African American community, I always kind of speak for that part there, and I always say that it's the earlier you kind of, I feel like the earlier you make it, make it as a part of it, or you introduce it to it, the better it's always going to be when it comes to us, because it's something that we have to move into, so in the more information we have, it gives us that it kind of gives us that information to kind of get a feel of what's done, like you said, like what's going on. Like you say, this is the future. The future is now, even though it's not there, but it's what, because I feel like right now a lot of people in the African American community are looking for alternative ways to look at themselves in health, and whether they're researching diet changing and exercising and these different aspects of medication and treating themselves. So I would say that, back to what I said in the beginning, that I was feeling like just a better introduction to it. I know it's going to be probably towards the future, but I feel like if you could probably focus on bringing the future into now, and just giving us, even entertaining them with it, it's going to be they'll be more receptive to it.
I agree. I would fully support and echo what you said. The future is now, and so one of the, so this is, and I think when the approach that we're taking, and we're so glad you're here, because it's I'll share with you our first program. No one joined. This is what the second time. So it is. What you're saying really resonates with me, because I do think it takes time for people to kind of meditate and think about the information that's available, and if it's something they want to pay attention to. So I agree with you. We do. It is a process, and so we're excited to start this process with you and others who have joined the call.
Especially with with younger adults. You have that you have this new breaking technology or in health, and you're even if I don't know how far along is it, and will it ever really be as successful, who I don't know that part about it, but it gives it ignites people, like, wow, that this is happening.
Yeah.
This is a possibility. This is the future of
right.
Yeah, and also I 100% agree with you that the future is now. There are technologies already, like when it comes to genetic testing. So when I was talking about reading the code and understanding, that is available. Those prices have been dropping at a crazy rate and become accessible to more and more people. And this is kind of, I think all the organizers here have this in common, is this passion of we need to talk about this and get this information out there. I'm a trained geneticist, and I feel very fortunate that when I go into a doctor's office, I know exactly what those tests are, what they mean. I know what to ask for. Just even being aware that they exist. I don't even have to know how they work, means I can ask those questions. And that realization to me made me switch to doing this type of work. I used to work full-time in a lab doing research, and that for sure is important. But for me, it was if people don't know that these things exist, how can they ever ask the right questions and make sure they're a part of it? And this is why, I can speak for our organization, but I think it's true for any of the organizers here. This is why we got started. That's exactly what you just said is almost our mission, right? Or almost exactly our mission is we need to go out there, and all these fancy things that are happening in these labs at Harvard Medical School, people need to be aware of it. And especially what you said about young people, one of our biggest pillars is writing lesson materials that teachers can use in their classrooms, from middle school to high school. It's one of our, because like Shanita said, these kids are the future, and they are going to be big consumers of these technologies. We already are, but for them, it's going to be such a big part of their lives. And so having that conversation early on so that they understand or at least are aware of it. I'm not saying everybody needs to become an expert in genetics. Believe me, I studied it for years. I don't wish that on anybody to go through that same trial and that full on, but just being aware and knowing that you can ask questions for yourself, for your family, it's so important, I feel.
Yeah. Actually, I wonder, because Dominic, that's your name, yeah?
Yes. Mm-hmm.
And that you were asking for more resources, and I was wondering, Dr. Hughes Halbert or Nadine, if you can put up, even like, I'm happy to share our website and our contact information. Also, I know your website, Dr.